The more I learn about these proposed rules by the Bush administration, the more appalled I am and the more determined I am to stop them. This is a gratuitous, unnecessary insult to the women of the United States of America. These rules pose a dire threat to women's health, to healthcare providers, and to uninsured and low-income Americans seeking care. It is a disgrace, but unfortunately, it is not a surprise. The Bush administration has long put ideology and politics ahead of science and women's health. And it's the women of our country, particularly the low-income and uninsured women, who pay the price. As soon as I heard about these proposed rules, I joined with my friend and colleague, Senator Patty Murray in the Senate, and wrote to the Secretary of Health and Human Services, urging him formally to reconsider and reject the release of these rules. I have fought these battles before. Senator Murray and I had to fight with the Bush administration over the course of several years to demand that a decision be made about emergency contraception. We won that fight, and we will win this fight as well. Here's what the Bush administration wants to do. They want to allow healthcare providers to classify many common forms of contraception as abortions, and therefore refuse to provide contraception to women who need it, even when the states, like New York, have laws on the books to ensure access to contraception. So just imagine what this means. Under these proposed rules, health insurance plans could disregard state laws that require covering prescription medications and prescription contraception by claiming that contraception is abortion. Women would watch their contraceptive coverage disappear overnight, and that's not all. Imagine that a sexual assault survivor walks into the emergency room, and in our state, we are one of 14 states with laws guaranteeing access to emergency contraception, but under these Bush rules, an ideologically driven hospital administrator or an emergency room supervisor or a doctor or a nurse on duty could deny this woman access to emergency contraception. So the woman who survived the assault would now be at risk of becoming pregnant, denied the care she needs in her hour of greatest need. These rules would also build new barriers to counseling, education, contraception, and preventive health services for those in need. It is an end run around the rights of women to make choices about our own health, and we are not going to stand for it. And therefore, I am joining my colleagues in the Senate and the House to send a message to the Bush administration: we will fight you every step of the way.